Can you tell us about how technology is being used in the therapy context? I've spoken to therapists who won't do Skype sessions because they think there's an empathy gap and there's presence and all those things. But there's also therapy bots that are on their way and all kinds of sort of technology that's coming up. So can you just give us a sense of?
Sure. So for all those of you we run a technology platform that has over 500,000 users and provides technology-based programs for people to work on their mental health, right? And so there's multiple layers to that question. One is around the whole idea of remote therapy versus face-to-face therapy, and there's clear evidence around the equivalence and impact, largely because what you lose in terms of that face-to-face connection is built up by a higher level of disclosure. So you actually tend to disclose more in remote therapy than you would in a face-to-face context, and that sort of counterbalances what loss happens in a face-to-face empathy contact that builds a more personal relationship. So there's clear evidence that face-to-face is online digital is as effective as face-to-face for most conditions, and I caveat that, right? There are certain conditions which require face-to-face intervention. The second is around saying, so we have had a fascinating journey. For the last 3-4 years, we started by just building an e-consultation platform, which essentially means you come online, you look at all the therapists that are available, and you connect to a therapist. And what we realized in that journey was we talked to over 1 lakh people. And two things that people raised as concerns, I was talking about this in the break. One was around the issue of cost. Right? Whilst the perception is that therapy is expensive, we were talking about the fact that even at 600 rupees, 700 rupees an hour, people would turn around in many parts of the country at many age groups and say, I can't afford that 4 times or 3 times a month. Right? So that the cost is an issue and real issue for some people. The second issue that people raised, and I'm talking about a large sample set here, right? And consistently raised was, I'm not mad. I don't need to see an expert. Just tell me what to do. Can you give me some suggestions on what to do? Which clearly showed a challenge around self-stigma. The idea that, so we talk about stigma constantly, where people don't want other people to know that they have a psychological issue. But here the issue is this is confidential. Here the issue is people don't want to fully accept yet that they need to go beyond just working with themselves, work with an expert, work with a professional. So, and that's why we built the platform that we built. So a lot of technology now is being built around AI, machine learning, to personalize and digitize programs that would actually try and teach you strategies that therapists teach you. They don't replace therapy in any way. They're not personalized at the same level as you would in a one-to-one therapy session, but they teach you strategies. And they personalize strategies to your condition, your symptom profile, and teach you the psychological skills and help you sort of practice them so that you can practice those skills and then feel better to some extent. And hopefully on that journey of self-discovery, you can then become more open to talking to somebody. That's the whole idea. So that's what technology is. So face-to-face and online equally effective, and then a lot of digital programs are now coming out to counter the masses. The problem is huge. Right? We're talking about a 95% treatment gap in India. That means that out of 100 people who need mental health treatment, only 5 people get it. So there's 95% treatment gap. So, and we have about, if we put everybody working as hard as Anjali and working all day long and all night long, we still wouldn't solve the problem even with 10, 15, 20 times the psychiatrists and psychologists. That's how big the treatment gap is. So there has to be some kind of technology enablement, and that's what we're trying to solve for essentially.